Whiplash, more than a soft tissue injury. Today we'll discuss the IME illusion, how independent medical examinations are used to control outcomes, scope, specialty, and silence, how these IMEs exclude evidence in whiplash and chronic pain. Today we'll show you where this comes from and how auto insurers save hundreds of millions of dollars each year doing this, and what you can do about it to protect yourself. The 1990s started a transition away from health and towards profit by moving from a functional recovery model to a disease management model. This transition resulted in billions of dollars of revenue to insurers. We will discuss the primary shifts that occurred in auto insurance, hospital settings, and healthcare insurance, and how Ontario's auto insurance industry today is based off this misguided 30-year-old ideology. First, Allstate and McKinsey documents. Allstate hired McKinsey and Company to develop a strategy to reduce claim cost. The results, according to the Allstate CEO at the time, was a $700 million per year savings. In order to do this, they had to suggest to you that they couldn't get hurt in a low-speed collision. In order to do this, they introduced accident reconstructionists into the claim process. They also had to devalue the primary treatment providers, chiropractors. So if you look at the screen on the left, you'll see a low-speed impact collision during live full-scale human volunteer crash testing. A typical injury mechanism in whiplash happens in about 60 to 80 milliseconds. What ACRs did is they used the in total time of the collision, which is about 500 milliseconds, instead of the injury mechanism time. This allowed them to reduce the G-force and suggest that the injury wasn't possible. If we look on the right side of the screen, we can see research from the Insurance Research Council found that chiropractors were the primary cost generators, whereas medical specialists had the lowest cost. Wonder why IMEs are only done by medical specialists today. And you'll even see on the lower screen on the right, the Quebec Task Force specifically stated that physical medicine costs $1.5 million per year compared to medical expenses at $230,000. This committee was tasked with treating the whiplash problem because of these costs, and this committee's recommendations is what you are treated with under the minor injury today. So how do insurers cure the whiplash problem? First, you get treated under a policy, not through what is medically needed. This is what our current minor injury guideline is. Then additional care outside of the minor injury has to be approved through a gatekeeper. In Ontario, that's typically a medical specialist that does not understand or treat whiplash. This allows a minimization of your injury. This is accomplished by suggesting that there is a medical hierarchy that does not exist. Let's explain how all this works so that you can protect yourself if you're ever injured in a motor vehicle accident. There will be several slides in this presentation where I give you factual information. This is for you to read and review during the presentation if you so choose. I won't go into each slide as that would make the presentation quite lengthy. Where it all started, the early 1990s, with Allstate hiring McKinsey and Company to redesign their claims handling process. This was an internal shift from claims handling for injuries to claims handling for profit, and it introduced several things that we still see today. This was the introduction of medical doctors as gatekeepers for chiropractors and chiropractic treatment. It was the introduction of accident reconstructionists and engineers to determine if you could get injured in a car accident. And it was the introduction of MIST, minor injury soft tissue, where there is an implication that if you had a soft tissue injury that lasted more than a couple weeks, you're committing fraud. And this is how the adjusters were taught to handle claims and where your benefits initially got limited. On the slide to the left, we can see some of the primary strategies McKinsey recommended Allstate do to limit costs. On the slide to the right, we can see some of the things we see today, like deny, delay, defend. Now with McKinsey, we never were allowed to see the entire PowerPoint slide presentation that they gave Allstate. This was about 12,500 slides. But what we can do is we can infer certain things that were recommended by McKinsey and Company to Allstate through different court filings and court claims. One specifically is Jacobson versus Allstate. The first strategy: low speed collisions can't cause injury. This was the claims core processing redesign that was introduced, and it was the program called MIST, Minor Impact Soft Tissue. Now, another primary introduction with this was the introduction of a computer program that determined injury called Colossus. Interestingly, Colossus was started in Australia, and at the time, chiropractors were not really recognized as real doctors in Australia. So this allowed for a potential bias to be put into the system to, again, reduce claim costs. Some of the core tactics used were denying claims using vague or arbitrary rationales, such as this is our policy or you have a minor injury, and also by sending claimants to inappropriate medical specialists. Step 1, the famous no crash, no cash. This suggested if there wasn't vehicle damage, you couldn't get hurt. What this doesn't account for is a peer-reviewed research that shows vehicle damage does not correlate with occupant injury, that there's an elastic rebound in low-speed collisions where these collisions can take up to 18 miles per hour vehicle impacts and show no damage at all. So this is not a valid injury threshold for whiplash, but by hiring accident reconstructionists and engineers to suggest the forces were low, Allstate initially was able to recoup hundreds of millions of dollars in potential settlements through misinformation and misusing the current literature. Next, they used perceived biases to create a fictional medical hierarchy where you had surgeons at the top, then medical specialists, family doctors, and chiropractors at the bottom. By bookending chiropractors, the doctors who primarily assess and treat whiplash, they were able to use medical specialists that look very well educated and which are very well educated in their own field to suggest an injury wasn't there or that the injury was minor. And this is why they did it. As you can see to the right, the primary body injury complaints after a car accident were neck sprains and back sprains, which contributed to a significantly higher portion of injury claims than the other claims listed below. The primary doctors treating these claims were chiropractors. If you get rid of chiropractors, you get rid of your primary costs. Remember how I said there is a large cost containment for Allstate? Well, what they found is the Allstate payouts per claim reduced from 65.9 cents per claim dollar collected to 51.7 cents per claim dollar collected, which again is over a $700 million per year savings. Now, this was later found to be a dishonest act by Allstate in courts, and in fact, their license to sell insurance was temporarily restricted in Florida because of this. And that's how we actually had the production of the McKinsey documents. This model is what we see our current minor injury guideline based off of in Ontario. In addition, the minor injury is also has contributions from the Quebec Task Force. But first, let me quickly discuss how the functional model was changing in the US in the 1990s in hospitals and through health insurance settings. And we'll see how there is a transition to disease management, which reduced overall insurer costs. These are slides from a continuing medical education program on pain management I took through Johns Hopkins, where they explain that the change to a disease management program for pain was more cost effective. In the presentation, they discuss how physicians in the US did not want a national healthcare insurance as it would reduce their funding. Through the 1970s and 80s, ICPM physical medicine programs proliferated until the 1990s, where they were considered too expensive. Health insurers, just like auto insurers, then decided to deny this care based on their so-called policies. So in the United States in the 1990s, auto insurers used a computer program called Colossus that focused on disease management to reduce claim cost, where at the same time, hospital and healthcare insurers also switched away from active physical care to disease management, as this was the most cost-effective solution for them. When we talk specifics about Ontario and auto claims, how do we know exclusion of chiropractors from impairment ratings is an insurance-driven policy? Well, the AMA guidelines list chiropractors as one of three doctors that the guide is intended to use to determine impairment. See for yourself on the left of the screen. So here's something I want to ask you before we continue. Do you think lawyers in Ontario should know this? And if so, shouldn't lawyers require a chiropractic opinion in their tort claim to ensure their client's injuries are fully assessed? And if a lawyer does not use a chiropractor for impairment ratings in Ontario, are they fulfilling their fiduciary duty to their clients? Just something to think about. Another question is, why have plaintiff injury lawyers in Ontario allowed chiropractors to be pushed out of the assessment process? Ontario's system is based off of documents in which chiropractors are considered physicians in the United States, but excluded as physicians in Ontario. This sleight of hand is actually a calculated insurance tactic to reduce claim costs. If you see on the left, a general assessment all regulated health professionals are allowed to complete. However, for catastrophic determination, it's specifically listed as physicians, but physicians can get assistance from regulated health professions. This way, they limit what injuries are actually assessed. So I have to ask, why have lawyers in Ontario allowed this? If all of this wasn't bad enough, Canadian auto insurers have publicly promoted guidelines behind the minor injury to control the whiplash problem by restricting chiropractic and physical therapy and embedding medical bias to cut down claim costs. Ready to learn more? The Quebec Task Force was commissioned by Quebec to address the so-called whiplash problem, and this was a strategy to reduce physical therapy costs. Now, just to put in perspective how outdated this guideline is, the research that began this QTF in 1993 was 1 year prior to the US FDA approving MRIs. And in 1995, when the publication was published in the Journal of Spine, only about 50% of hospitals had access to MRI, and it was not even common usage at that point. So the QTF, the purpose was a scientific monograph on whiplash. The problem is they didn't really use science. And the issue with this publication is the Quebec government tasked them to reduce the so-called whiplash problem, which was physiotherapy was costing the government $1.5 million a year compared to medical costs of only $230,000. So what happened is they developed a grading system for the treatment of whiplash, which they called whiplash associated disorders, or WAD. Now the problem is that you'll see on most claim forms, doctors will diagnose patients with a WAD injury, and independent medical assessors will say that they had a WAD 1 or a WAD 2, so they're limited to the minor injury guideline benefits. The problem is the WAD terminology is not a legitimate diagnosis, and this is straight from the authors. Now, this is important as it shows that the idea about evidence-based medicine and the idea about soft tissue injury is nothing more than an insurance strategy. The authors stated, there is no decent epidemiology, nothing written on diagnosis, and barely any treatment discussed in the work. So our treatment determinations through the minor injury today are not based on research. And this is where we get the minor injury recovery time frame of 4 to 6 weeks. Sometimes it's 6 to 12 weeks or 12 to 15 weeks, but in that time frame. Now, a few things with this slide. First, the IME statement that whiplash is usually self-limiting comes from here. All the authors of this guide meant is that in 1987, the median time to recovery was 31 days. Now, the key thing here is the word recovery. The authors used the word recovery to mean that insurance compensation ended. This just means that the person went back to work or that they decided not to file a claim. So the actual word recovery does not mean a resolution of symptoms. Also on this page on the right, highlighted is the famous statement about reassuring patients that whiplash injuries are, as they state, self-limited, involving temporary discomfort and rarely resulting in permanent harm. Again, according to no research, since they said they had none, which we noted above. And also, the data is from 1987, almost 40 years ago. But that's not all. They also suggest pain is not harmful. I commonly see IME statements that state the prognosis for sprain strains at the physiological level is typically good. The underlying pathology of these injuries is that they heal over time and do not spontaneously deteriorate or degenerate. However, pain may persist even after structural healing of any injury has been completed. No, this is what authors paid by the Quebec government suggested in the absence of, as they stated, no decent epidemiology, nothing written on diagnosis, and barely any treatment discussed in the work and the literature they reviewed. What we really know is about 52% of those injured develop chronic pain. And in the longest study reported by Squires, they found that 45.5% of people still had symptoms 30 years post-accident, well after compensation claims were closed. And yes, chronic pain is harmful. According to Dr. Sean Mackey from Stanford Pain Lab, which in my opinion is one of the premier pain labs in the world, found that chronic pain, regardless of severity, resulted in an additional 10 years of brain atrophy. That means if your pain's a 1 out of 10, a 5 out of 10, or a 10 out of 10, it still resulted in brain atrophy. So I would say the pain is harmful. This idea of soft tissue injury and pain not being harmful and injuries self-resolving by themselves remind me of other medical misconceptions of the 1990s. How opiates were safe and non-addictive. Well, we all know how that worked out. And how insurers like to push the idea of being evidence-based. Well, here's the lengthy article that led the US opiate epidemic. I guess they did have two references. And ever wonder why insurers and IME doctors put an emphasis on going to the hospital and getting MRIs, CTs, and X-rays after an accident? It's because they knew that this would not show up in whiplash injuries. It's right there in print. Ever wonder why facet joint testing isn't standard? Because this was the primary pain generator in whiplash. They knew this in 1985. And while a chiropractor can use a physical examination to determine a diagnosis of facet joint injury, guess what? The medical standard is facet joint injection to determine the diagnosis of a facet injury, which you cannot do during an IME. So why are medical doctors given such a high preference to determine injury and whiplash claims? Because every test that they rely on to diagnose severe, life-threatening injuries and provide surgical or medicinal care to will be negative for whiplash patients. You know what they say, if you're not looking for it, you won't find it. So just to be thorough, here are the therapies with a number of research studies that were used to make the QTF recommendations. Not much at all. Here's additional therapies such as physiotherapy, ultrasound, injections. Again, not very much research. How many times have you seen an IME doctor state whiplash injuries usually recover on their own and that the injury is usually self-limited? Well, this is where it comes from. The authors even say that only 1.9% of whiplash patients were disabled after 1 year. Interestingly, the only research cited to support this was by Norris and Watt, Randanoff, and Hildegson, which reported 66%, 27%, and 44% of patients were disabled after 1 year. Maybe they rounded down? So Allstate used McKinsey documents to reduce chiropractic input. Hospitals and medical schools transitioned from active care to disease management. All at the same time, Canadian insurers were seeing that single-payer motor vehicle accident claims paid out were increasing, which, as they stated, represented a substantial financial burden, and commissioned researchers to develop guidelines for the management of whiplash without having any acceptable research to do so. And if this wasn't bad enough, while insurers were actively trying to limit chiropractic for cost containment, the American Medical Association also attempted to reduce the credibility of chiropractic, as the Supreme Court put it, to contain and eliminate a competitor. Court transcripts show that MDs were taught to distrust chiropractors, and this ideology had been pushed on medical doctors since the 1960s, all to reduce compensation and competition in the healthcare sector. Again, with insurers requiring chiropractic treatment plans to be gate-kept by MDs, this was a calculated strategy in which insurers knew most, if not all, medical doctors would deny this care as not reasonable and necessary because that is what they had been taught for 40 years. Here's what the court said. And here too, I won't get into this, but this would be a good slide to pause on and read, especially the middle portion with insurance good faith and fair dealings. So at the end of the day, auto insurers devalue chiropractic because it costs almost 3 times more than medical care. Health insurers and hospitals transitioned away from physical medicine care such as chiropractic and physical therapy because it was not a so-called cash cow and moved towards a more profitable disease management program. Think about it. If you don't fix or cure the disease but only manage it, you have a lifelong customer. But on the positive side, the AMA did lose the Wilk suit, so they can no longer defame and make lies about chiropractic, or at least we hoped. Right after the AMA antitrust lawsuit and all of the appeals were over and chiropractors had won, Huffnagel published an article in the Journal of Neurology. This paper reports 10 strokes occurred after cervical spine manipulation that was described as chiropractic manipulation. This again feels like the opiate epidemic. Opiates are safe, don't worry. Just like chiropractic is dangerous, run away. Seems like another attempt to contain and eliminate a profession. Were you fooled? If you look at the research article, patients did suffer strokes from manipulation, but it was manipulation from orthopedic specialists and other non-chiropractic providers. As you can see to the right, even a kung fu practitioner, massage therapist, and other medical doctors, these are the so-called providers that cause chiropractic manipulation strokes. They didn't tell you that though, did they? Then Murphy followed with another stroke article on chiropractic. He just forgot to tell you that it was a barber in India that caused the stroke, not a chiropractor. Oops. What research really says? According to Medicare stats, it is actually more likely to suffer a stroke from seeing a medical doctor than a chiropractor, roughly about 1.4 per thousand versus 1.2 per thousand. In reality, these professions don't cause strokes. Typically what's happening is there's some kind of normal variant in the artery. And if you don't assess that correctly or diagnose it correctly, the stroke happens. So it's more a lack of appropriate diagnosis, just in my opinion, rather than the actual services being provided. Again, just my opinion. Why is this relevant? Well, it brings us back to the old IME saying that this treatment is not evidence-based when they deny the chiropractic treatment plan. And evidence-based means supported by peer-reviewed research. I think it's important, however, the problem is with this research, there's a lot of political and financial backings more than evidence-based medicine. I think you're starting to get the idea. Even with the British Journal of Medicine, they stated only about 15% of medical interventions are supported by scientific evidence. Yet they will deny your chiropractic and physical therapy care because it's not so-called evidence-based and recommend injections and other pharmaceuticals to so-called manage your symptoms. And insurers are aware that medical doctors were initially trained to distrust chiropractors. Maybe they still are to a degree, who knows? Insurers are also aware that medical doctors in general are not very good at treating or assessing pain. Research from Friedman shows that outside of orthopedics, medical doctors have a very basic, almost remedial understanding of the musculoskeletal system, one of the primary systems injured in whiplash, and that most doctors will misdiagnose pain conditions that are mild to moderate according to pain continuing medical education from the University of Pennsylvania. US lawyers caught on to this. Ontario lawyers, we're still waiting for you to catch up. So, what is whiplash, and how can insurers frame your injury to look like it's not there? They suggest that all whiplash is self resolving, and that if you have continued disability, you must be lying and trying to get a settlement. In reality, whiplash is really a cervical cephalic syndrome that is a time sensitive, neurofunctional injury involving the upper cervical spine and brain. And this is a progressive disease state that worsens over time. It, in fact, is actually a much more severe disease state than most injuries. This is the pain cycle by Dr. Koh from Stanford Medicine. We can see injury at the bottom that leads to a number of consequences if not corrected. Remember how they said pain was not serious? Well, the difference is that in most sprain strain injuries and other traumas, the left side of the chart plays into the pain condition for several weeks or months until it transitions to chronic pain and the consequences of the chronic pain symptoms on the right side of the chart. The problem with whiplash research has shown from the Journal of Pain that this transition can occur in as little as 48 to 72 hours. Once we hit the right side of the chart, this is where the progressive disease part starts, with hormone changes, psychiatric changes, biomechanical changes, and immune dysfunction. But remember what our physiatrist said earlier? The prognosis for sprain strains at the physiological level is typically good. The underlying pathology of these injuries is that they heal over time and do not spontaneously deteriorate or degenerate. However, pain may persist even after structural healing of any injuries has been completed. Well, this is not a sprain strain, and the prognosis is not typically good. Also, he was right about the condition will spontaneously deteriorate or degenerate as long as the not before the statement was a typo. So, why is it so important that auto insurers transition from a functional treatment model to a disease management model? Well, whiplash is a functional injury that continues to worsen as the body continues to try to compensate for loss of function. The problem, most medical tests that we have available to us are not functional tests, they're static tests. So, how does this work? Imagine you feel like you're in a constant fog. You keep forgetting things and even forget your friend's name sometimes. They send you for a head MRI, which comes back normal. Why? Because the head MRI is looking for a brain bleed, a tumor, or some kind of structural change to the gray or white matter. You don't have this with whiplash. You have an issue with the brainwave function, which can be seen on the right picture. This is a QEEG. The Department of Defense has been using this since the 1990s and calls this the holy grail for the assessment and treatment of war veterans that have chronic pain, insomnia, PTSD, and concussions. Why don't we use this in Ontario? Well, I do, but insurers think this is not evidence-based and they typically will not approve it. Why? Because 100% of those injured in motor vehicle accidents would probably show a positive test. And every doctor in Ontario could learn this in a few years and implement it into their practice. Here are the numbers that determine the policy. This shows the majority of rehab requirements fall under the category of injury, which chiropractors and physical therapists would be responsible for treating, as compared to serious injuries that medical doctors would be responsible to treat. We found out through Allstate and the McKinsey documents in the 1990s, this is why there is a transition. By having medical doctors assess the need for chiropractic and physical therapy treatments, which account for over 90% of the injury claims, we can limit the benefits to those injured. This is because medical doctors are based on a risk-based acute ambulatory care model. In Ontario, This can equate to over $7 billion of savings. This forces the OHIP system to be burdened with the cost of this care. Oh, and because medical IMEs are expensive, our auto insurance also goes up. So quickly, we'll talk about the science. First, no cash, no crash. As we discussed, this is where Allstate introduced accident reconstructionists and engineers. From this point on, I'll just say ACRs for both of them, to determine force and suggest low-speed collisions could not cause injury. First, I'm also an ACR. ACR was developed to determine the least possible speed, meaning if an equation determined that the vehicle was going 20 miles per hour, that meant the vehicle could not have been going less than 20 miles per hour. It could have been going faster though. Next, ACRs use single vector forces, which are not the same as real-world MVA collision forces, which result in 6 forces acting on the neck almost instantaneously. So here's how the trick works. By using ACRs, they use the entire time of the collision, about half a second. Whereas a chiropractor trained in crash forensics understands that the neck and head undergo a peak acceleration force typically around 60 to 80 milliseconds. So when you manipulate the time of the collision, this can make the force or the G-force look greater or higher. The next stage is to manipulate injury potential. By using a single force, in the case of a linear force, the suggestion is that you need a higher G-force to sustain a concussion. When looking at the injury mechanics of whiplash to the cervical spine, researchers who actually understand whiplash found that you could sustain a concussion as low as 5 Gs. It's quite a difference. I wonder why Allstate introduced ACRs in the 1990s. After the G-force is minimized, then they equate this to a typical activity of daily living force. So now they say that you are a fraud and you're trying to get a payout because the force of your injury is the same as someone sneezing. And this just is not the case because of the injury mechanics specific to whiplash. And here's a reason why they transitioned away from chiropractic towards MDs by insurance companies in the 1990s. If we look at the x-ray to the left, this is what an MD typically will look for. Things that will kill you, things that are serious, things that need surgery. If we look at the x-ray to the right, chiropractors will also evaluate the things to the left, but if we look at the x-ray to the right, we're looking for functional changes that show that there's an instability, ligament loss, muscle splinting, and that's what we look for on these imaging. So in Whiplash in Ontario, the standard for most MDs is to do 2 views, AP and lateral. On the left of the screen is a lateral view. You can see that they're primarily just looking for fractures, serious traumas that may need surgery, that kind of information. So a lot of times the report will come back as a negative report. As a chiropractor, I would do a stress views, which is seen on the right side of the screen. This shows where the yellow numbers are, translation of the vertebral bodies. This tells me there is a ligament failure. What happens when this ligament fails? You'll feel like your neck is always tight and stiff. You could get frequent headaches, blurred vision, mental fogginess, loss of short-term memory, tinnitus, which is ringing in the ears, pain swallowing. Any of these sound familiar after a motor vehicle accident? So if we look at the left side of the screen, this is something called a reverse S-curve, which is very common in whiplash. MDs consider this an incidental finding, or at least in the reports I've read. For me, though, it tells me there's a loss of ligament function, and it tells me that you only have about 3 weeks to get the correct treatment. Otherwise, the ligament will heal incorrectly. If we look at the picture on the right, this is a microscopic picture of a ligament. And basically, after 3 weeks, if the right treatment is not provided, it will heal structurally intact, so your CTs and MRIs will come back negative, but functionally weak. So this slide attempts to put it together. The first x-ray is a picture of the spine in neutral. The second x-ray is a picture in a stress view. And if we look at the second and third square down, you can see how the bones have shifted. The third picture is a picture of the ligaments that have to be damaged to allow that bone to shift. Now, if we watch the video, at the top part of the spine, right here, you can see the ligament shift. And that's the issue. When people look down too long or look up too long, it can trigger neurological symptoms. And that's because the spine is unstable. This often gets missed in our system, and especially with the exclusion of chiropractors who specifically look for this functional loss, it can get missed. The same goes for vestibular dysfunction. Medical doctors typically only look at the inner ear. Chiropractors look at the functional system, including the eyes and the neck. So what does this look like? If we look at the picture on the left, this is a pupil response. When we get that pupil response, we basically just know the person is not brain dead. So this would be a negative cranial nerve 2 and 3 test. If we look at the video on the right, see how the eye jets out? So this is a functional loss of cranial nerve 2 and 3. When you have this, what happens is that you might get headaches or blurred vision or migraines when working on a screen or computer too long. You might get motion sickness in a car. These are functional changes. So this is why a medical doctor can say that your cranial nerve testing is negative and be correct, and a chiropractic doctor can say that your cranial nerve testing is positive and also be correct. So again, why are chiropractors pushed out of the system? Well, if you take just these two injuries alone, there's a very high CAT potential, catastrophic impairment. But again, the lawyers in Ontario, for some reason, are still living in 1985 and don't typically use chiropractors for tort. So I have to ask the question, with what you know now, if these lawyers are not using chiropractors in their impairment ratings, are they fulfilling their fiduciary responsibility to their clients? You tell me. And just in case you weren't sure, even the AMA, after they tried to destroy the chiropractic profession 30 years ago, now lists chiropractors as one of 3 doctors that are intended to use the guide to determine impairment. It's right there in black and white. But it's not all the lawyer's fault. In Ontario, 5 professions can use the term doctor and diagnose. There's no hierarchy according to the Regulated Health Professions Act of 1991. And in fact, medical doctors and chiropractic doctors even have different scopes under this act. But somehow, auto insurers were able to have the SABS, the Statutory Accident Benefit Schedule, which is the law that regulates care for accident victims in Ontario, to limit chiropractic testimony and require an MD to gatekeep their work in catastrophic impairments. Remember where gatekeeping came from? Allstate and the McKinsey documents in the 1990s. And remember how that reduced claim cost $700 million per year? See how it's all tying in? Here's our current MIG in Ontario, minor injury guideline. Interestingly, you can see that injury is the same as impairment. And in the previous slide, you can see any healthcare provider can complete an OCF 23 or OCF 18 and diagnose injury. But only physicians can give a catastrophic impairment diagnosis, even though it's considered the same thing, an impairment. And if you look how they define whiplash, they use the idea of sprain strain and the WAD terminology used by the QTF. They also allude to WAD being benign and that most injuries are not serious and they heal fully, again from the QTF. Remember the whole 4 research articles they used to make these conclusions and how only 1.9% of those injured had disability after 1 year, even though the research showed over 60%? The truth, here are most of the long-term studies on whiplash. Chronic pain is a very real concern and predominantly seen in whiplash and motor vehicle trauma. So the way they use this is that there is a suggestion that WAD 1 and WAD 2 are minor injuries, and that any severe injury must have a neurological sign, which is a loss of muscle, reflex, or sensories. This way, when they do an IME, they can ignore other neurological issues, such as memory loss, vestibular dysfunction, referred pain, or tinnitus. See the highlighted portion below the first picture that shows this? So the neurology exam only focuses on MRSs, which you can see an example to the right. This does not evaluate the entire person or injury. Then the conclusion is that from a neurological point of view, there is no impairment, or as you saw above, injury. And they just ignore pain. This is how the minor injury guideline works when you exclude chiropractic. Now, we have known since the 1950s that common whiplash symptoms include memory loss and numbness and psychological issues. In 2015, Aviva co-sponsored a research program to update the QTF called Enabling Recovery from Common Traffic Injuries, a focus on the injured person. And they switched the terminology from WAD, W-A-D, to NAD, N-A-D. The authors found with a loss of cervical lordosis, which we discussed just recently, the reverse S-curve, significant issues where, I quote, the majority of patients with such injuries will require a significant amount of medical, surgical, rehabilitation, and or psychological intervention. After this publication, the insurance industry decided to not update the previous year's minor injury guidelines that were based off the QTF findings. And this is what we still have today. So what is whiplash? Well, it's actually a cervicocephalic syndrome that worsens over time if you do not get the right treatment. So just to summarize, CAT determinations and MIG guidelines enable medical gatekeeping to limit claims, assume whiplash injuries are minor and self-resolving, contrary to what the evidence actually says, and it caps functional care in favor of profit-driven pharmaceutical approaches and allows disease-focused opinions to override functional-based expertise. Despite whiplash being a functional spinal condition, which is best assessed and managed by chiropractors trained in segmental biomechanics, neuromuscular control, and movement-based evaluations. Now consider this. I am the only doctor in the world that has been accredited and endorsed to teach a whiplash traumatology, neurophysiology, and pain management program to medical doctors, chiropractic doctors, and doctors of physical therapy in 29 countries. Yet in Ontario, Canada, a general family doctor with no training in whiplash carries more weight regarding a whiplash injury and catastrophic impairment determination in our current legal system. What do you think of this? Bonus time. Lawyers, do better. Request a Form 53, but don't just request a Form 53. Under the expert line, make the independent medical assessor state that they are an expert in the benefit that is being requested. This is a requirement. The CPSO has strict guidelines regarding the practice of IMEs, that there has to be specific certifications and experience, and that these IME doctors have to perform the procedures to patients that they manage. Get them to sign a Form 53 specifically stating they're an expert in whiplash traumatology, chiropractic, physical therapy, acupuncture. They won't do it. Patients, beware. I've seen letters to some of my patients from auto insurers that suggest that you can only get treatment in the minor injury. This is not true. I've also seen letters that say that you have to go to their preferred providers. This again is not a law and it is not true. What you can do when they offer the preferred provider program is ask the adjuster, who's the doctor? They typically won't know. Ask the adjuster, what qualifications does this doctor have? They typically won't know. This is a profit-driven system. Please remember this. If you've been hurt in a car accident, schedule an in-person assessment or we do virtual consultations. Take control of your health. And here are some red flags that I tell my patients to look out for. First, when you're seeking care for treatment, the treatment should always be hands-on for the entire session. If your doctor states you just have whiplash, it's a minor injury, or you have pain because you're old, and yes, I've had patients tell me that their previous doctors said this, run as fast as you can. Find a new healthcare provider. All treatments need to include a functional program, functional exercise, muscle work, specific, not generic strengthening, pain control therapies through physiotherapy. You have to develop a baseline where your body is and slowly progress it over time to get better. If you don't get multiple forms of treatment on each visit, chiropractic, physiotherapy, acupuncture, kinesiology, vestibular rehab, biofeedback, neurofeedback. Now, you don't need all of these, it has to be specific to your condition, but you do need more than one or two of these to get better. If you don't get it, you're probably not going to fully recover. Again, very generic statement. Each person is different. Everyone's response will be different. I'm basing this on my training, education, and experience, also in treating over 60,000 patients in my last 20 years. This is just what I've seen. Opinions and professional voices matter, especially when they're grounded in evidence, regulation, and patient outcomes. Real change in Ontario's insurance and healthcare system will only happen when these systemic practices are exposed, questioned, and challenged. The more clinicians, patients, and advocates who pay attention, speak up, and follow these discussions, the greater leverage we have to demand accountability, fairness, and true evidence-based care. So I would ask you to follow this account and my other social media platforms. Share this conversation. Let's work to make Ontario healthier, fairer, and happier in 2026 for patients and providers alike. And finally, please remember, this is not medical or legal advice. This is a summary of things that I have researched, learned, and seen in my 20 years of whiplash traumatology study and work. Please feel free to reach out with any questions or concerns. The content here is only a handful of slides out of the 34-hour whiplash traumatology program that I've developed and taught. There's so much more about whiplash, its injury, its treatment needs, and how to truly assess and diagnose it. If you're a healthcare provider and this provides interest, consider taking this course. Thank you for your time and consideration.